Welcome, this is Christine with SocialSecurityCoach.org. Today we're going to be talking about Medicare basics. This is the first video in a series on SocialSecurityCoach.org discussing Medicare. And today's video is an introduction to Medicare, including who qualifies, what expenses are covered, how to enroll. I hope you enjoy today's video and invite you to check back for more videos on Medicare and Social Security soon. Okay, so let's get started. So who qualifies for Medicare? Medicare is health insurance offered by the federal government in the United States, and the following people may qualify for Medicare. People age 65 or older, people under age 65 with certain disabilities, and people of any age with end-stage renal disease, which is permanent kidney failure requiring dialysis or a kidney transplant. Medicare helps pay for health care, but it does not cover all medical expenses. Basically, Medicare covers services that it deems medically necessary. Not included in this definition are vision, hearing, and dental care. Also, nursing home care and medical services received outside the United States are not covered. And even the services that Medicare does cover, there are deductibles and copays, so you should be prepared to pay out-of-pocket expenses with Medicare, probably more so than when you were covered under a traditional health insurance plan. Part A, which is generally called hospital insurance, covers services associated with inpatient hospital care, including an overnight stay in a hospital, a skilled nursing facility, or a psychiatric hospital. Part A also covers hospice care, home health care, and medications received while in the hospital. Part B covers your doctor bills and other outpatient services. Some of the bills covered include medical equipment, lab tests, and rehab. Doctor services are paid by Part B, whether received in the hospital or in the doctor's office. While Part A covers medicines received while in the hospital, medicines administered in a doctor's office are covered by Part B. Other services covered under Part B include ambulance service, preventative care, and annual wellness visits. Now, Part C is a different creature altogether. Instead of covering specific benefits, Part C offers you a different way to receive your Medicare benefits. Basically, Part C is an insurance package that covers Part A, Part B, and sometimes even Part D benefits. Part C is often referred to as Medicare Advantage. Part D covers prescription drugs, including insulin supplies and even some vaccines. The only way to get prescription coverage is to enroll in a Part D drug plan or to join a Medicare Advantage plan that includes prescription coverage. So here's an example of how Medicare coverage works. Assume you break your hip and you have to go into the hospital for 4 days. Medicare Part B covers the cost of taking an ambulance to the hospital. Once you're in the hospital, Part A takes over and covers your expenses while in the hospital, such as room, meals, and nursing care. Part A also covers the cost of the emergency room and any medications received while you're in the hospital. Going back to Part B, your doctor bills, physical therapy, and the cost of using a wheelchair are covered by Part B. Note that your doctor bills are covered whether you see your doctor while in the hospital or at the doctor's office. I hope you enjoyed this video. To learn more about Medicare and Social Security, I encourage you to visit SocialSecurityCoach.org, where you can find many articles and resources on these programs. This is Christine with SocialSecurityCoach.org signing off and wishing you a great day.